What if the habit you were told to feel ashamed of your entire life turns out to be one of the greatest gifts you can give your body after 60? What if the shame was the lie and the habit was the medicine? Let's get into it. Welcome back to the channel. If you're new here, my name is Dr. Julia Rhodes. This is the place where we have the honest conversations about men's sexual health that your doctor probably doesn't have time for and that nobody else seems willing to have. Today's topic is one of those conversations. We're talking about masturbation, solo sex, self-pleasure. Call it whatever makes you comfortable. But whatever you call it, we are going to talk about it seriously, scientifically, and without any of the shame that most men over 60 have been carrying around this subject for decades. Because here's the truth. The shame you were handed about this habit, it wasn't based on science. It wasn't based on medicine. It was based on culture, religion, and social conditioning from a time when nobody actually understood what the human body needed. Stay with me. This is going to be one of the most important videos you watch this year. Why men over 60 stop, and why that's a problem. Let's start at the beginning. Why do so many men over 60 slow down or stop masturbating entirely? There are a few reasons, and most of them have nothing to do with desire. Reason number 1, shame and guilt. Most men over 60 grew up in an era where masturbation was treated as something immoral, sinful, or at the very least, deeply embarrassing. Religion, culture, and parenting all played a role. Some men were explicitly told it would make them weak, drain their energy, or cause physical harm. None of that is true, but those messages stick. They get buried in the back of your mind, and as you get older, instead of questioning those beliefs, many men quietly surrender to them. Reason number 2, the assumption that desire is supposed to fade. A lot of men hit 60 and notice that their sex drive isn't what it used to be. And instead of addressing that as a health issue, which it is, they treat it as a verdict. I'm just old now. That part of my life is over. They accept it. They move on. And in doing so, they accidentally accelerate the very decline they were trying to accept. Reason number 3, physical changes that feel discouraging. After 60, erections may not be as firm as they once were. Orgasms may feel slightly less intense. The refractory period, the time your body needs to recover between sexual events, gets longer. For many men, these changes feel like their body is telling them to stop. In reality, their body is telling them exactly the opposite. Here's what you need to understand. Sexual function in men is governed by a principle that doctors call use it or lose it. This isn't a metaphor. It is a biological reality. The less frequently you engage in sexual activity, including solo sexual activity, the harder it becomes for your body to perform when you want it to. Blood flow decreases. Tissues lose elasticity. Nerve sensitivity declines. Testosterone drops further. Stopping masturbation after 60 doesn't preserve your sexual health. It quietly erodes it. And that brings us to the real conversation. What masturbation is actually doing for your body, and why it matters more at 60 than it ever did before. The prostate, your most important reason to keep going. Let's start with the one that surprises most men the most, the prostate. Your prostate gland is roughly the size of a walnut. It sits just below your bladder and surrounds part of your urethra. And after 60, it becomes one of the most talked about organs in men's health, because prostate cancer is the second most common cancer in men worldwide. Now here's what most men don't know. Regular ejaculation, whether through partnered sex or masturbation, has been directly linked to a reduced risk of prostate cancer. A landmark study published in the journal European Urology followed over 31,000 men for 18 years. The findings were remarkable. Men who ejaculated 21 or more times per month had a significantly lower risk of prostate cancer compared to men who ejaculated only 4 to 7 times per month. Why does this happen? The theory is that regular ejaculation helps flush out potentially carcinogenic substances that can accumulate in the prostate fluid over time. Think of it like draining a pipe. When you ejaculate regularly, you're clearing out the prostate. When you don't, things stagnate. Beyond cancer risk, regular ejaculation also helps reduce inflammation in the prostate. Prostatitis, inflammation of the prostate, is incredibly common in older men and can cause discomfort, urinary problems, and sexual dysfunction. Regular ejaculation is one of the natural ways the body manages and prevents this inflammation. So let's be completely clear. If you are a man over 60 and you have been avoiding masturbation out of shame or habit, your prostate has been quietly paying the price. Your heart and circulation. Here's something most men never connect. Sexual activity, including masturbation, is genuinely good for your cardiovascular system. When you become sexually aroused, your heart rate increases. Blood vessels dilate. Blood flow surges throughout your entire body, including to your genitals. This temporary increase in circulation is remarkably similar to moderate physical exercise. And just like moderate exercise, repeated over time, it produces real cardiovascular benefits. Research has shown that men who maintain regular sexual activity have better vascular health than those who don't. And for men over 60, vascular health isn't just about sex, it affects everything. Your energy levels, your brain function, your risk of heart attack and stroke. Here's another important connection that most people miss. Erectile health and cardiovascular health are deeply linked. The same conditions that damage your blood vessels, high blood pressure, high cholesterol, diabetes, smoking, are also the primary causes of erectile dysfunction in older men. The penis, in many ways, is a barometer for the health of your entire circulatory system. When you maintain regular sexual activity after 60, you are maintaining regular blood flow to the penile tissue. That blood flow keeps the tissue healthy, oxygenated, and responsive. When you stop, that tissue begins to change. It loses elasticity. It becomes harder to engorge. And over time, what started as occasional difficulty becomes a more permanent problem. The message here is straightforward. Masturbation, practiced regularly, is a form of cardiovascular maintenance. It keeps the pipes open, it keeps the blood moving, and it protects one of the most important organs in your body, your heart, in the process. Your brain and mental health. Now let's talk about what happens above the neck. When you reach orgasm, your brain releases a cascade of neurochemicals. Dopamine, the feel-good neurotransmitter, floods your system. Oxytocin, sometimes called the bonding hormone, surges and creates a powerful feeling of warmth, contentment, and calm. Endorphins, your body's natural painkillers, are released in significant quantities, and serotonin, the mood-stabilizing neurotransmitter, rises as well. This cocktail of neurochemicals produces effects that are genuinely therapeutic. Stress drops dramatically, anxiety eases, mood lifts. And these effects aren't just pleasant, they're measurable, they're repeatable, and they have real implications for the long-term mental health of men over 60. Depression and anxiety in older men are seriously underdiagnosed and undertreated. Society often doesn't take the emotional lives of older men seriously. Men themselves are often taught to suppress and ignore their emotional needs. The result is that a huge number of men over 60 are quietly struggling, feeling disconnected, low, unmotivated, and lonely, without ever naming it or addressing it. Regular sexual activity, including masturbation, won't replace therapy or medical treatment when it's needed, but it is one of the most powerful natural mood-regulating tools available to men of any age. The neurochemical release that comes with orgasm is real, consistent, and reliable. Men who maintain regular sexual activity report significantly better emotional well-being, lower rates of depression, and higher overall life satisfaction. There's also the connection between sexual activity and cognitive health. Emerging research suggests that regular sexual activity stimulates the brain in ways that may help protect against cognitive decline. The surge of blood flow to the brain during arousal and orgasm, combined with the neurochemical stimulation, appears to support neural health and brain plasticity. In short, regular masturbation after 60 isn't just good for your body, it is good for your mind in ways that are just beginning to be fully understood by science. Sleep, the hidden benefit nobody talks about. Let's talk about sleep, because if there's one thing older men consistently struggle with, it's getting deep, restful, restorative sleep. After 60, sleep architecture changes. Deep sleep becomes shorter. REM sleep becomes more fragmented. Men wake more frequently in the night. And poor sleep has cascading effects on everything: energy, mood, cognition, immune function, testosterone levels, and sexual health. Here's where masturbation enters the picture in a way most people never expect. After orgasm, the body releases prolactin, a hormone that produces a powerful sensation of relaxation and drowsiness. Prolactin is directly linked to sleep onset and sleep depth. It is, in effect, your body's natural sleeping pill, and it is released in significant quantities after every orgasm. The oxytocin released during orgasm also contributes to relaxation and sleep quality. Together, these hormones create what many men describe as a deeply calm, heavy, almost sedative feeling after sexual activity. That feeling is not just pleasant, it is biochemically real, and it is one of the most effective natural tools for improving sleep quality in older men. Men who masturbate regularly often report falling asleep faster, sleeping more deeply, and waking up feeling more rested. And better sleep in turn supports higher testosterone levels, better cardiovascular health, sharper cognition, and stronger sexual function. In other words, better sleep and better sexual health form a positive feedback loop. Each one supports the other. And masturbation is one of the most effective ways to activate that loop after 60. Testosterone and hormonal health. Let's talk about testosterone, because this is where things get really interesting. Testosterone levels in men begin to decline at roughly 1% per year after the age of 30. By the time a man reaches 60, his testosterone levels may be 30 to 40% lower than they were in his prime. This decline contributes to reduced libido, lower energy, decreased muscle mass, increased body fat, mood changes, and reduced sexual function. Now here's what most men don't realize. Regular sexual activity, including masturbation, plays a role in maintaining testosterone levels. Sexual arousal triggers a hormonal response that includes a temporary but significant increase in testosterone. Over time, men who maintain regular sexual activity tend to have higher baseline testosterone levels than those who are sexually inactive. The body, in essence, responds to demand. When you consistently signal to your body that sexual function is needed, your body works to maintain the hormonal environment that supports it. Conversely, when sexual activity drops off, when the signals stop coming, the body gradually adjusts its hormonal output downward. This is part of why men who become sexually inactive after 60 often notice an acceleration of the symptoms of low testosterone: fatigue, low mood, reduced drive, and difficulty with erections. Masturbation is not a substitute for medical treatment when testosterone levels are clinically low, but it is a legitimate, scientifically supported way to keep your hormonal system engaged, active, and functioning at its best. Pelvic floor health and erectile function. There's one more physical benefit that deserves its own section, and it's one that almost nobody talks about in the context of masturbation: your pelvic floor muscles. The pelvic floor is a group of muscles at the base of your pelvis that support your bladder, bowel, and sexual organs. These muscles are directly involved in erectile function, ejaculatory control, and bladder control. And like all muscles, they weaken with age and inactivity. Weak pelvic floor muscles contribute to urinary incontinence, one of the most common and embarrassing problems men face after 60. They also contribute to erectile dysfunction and reduced sexual performance. Here's the connection. The rhythmic contractions of orgasm, both during the buildup and at the moment of climax, are essentially a workout for your pelvic floor muscles. Every orgasm engages, contracts, and strengthens these muscles in a way that is remarkably similar to deliberate pelvic floor exercises. Men who maintain regular sexual activity tend to have stronger pelvic floor muscles than those who don't. Stronger pelvic floor muscles mean better erectile function, better ejaculatory control, and better bladder control. These are not small quality of life improvements. For men over 60, these are the difference between feeling vital and capable and feeling like your body is failing you. Now, I want to pause here for just a moment, because everything we've talked about so far is the foundation, the science, the facts, the case for why this habit matters. But I know many of you watching this are dealing with challenges that go beyond just the habit itself. Maybe you're dealing with erection issues that are affecting your confidence. Maybe the performance in the bedroom isn't what you want it to be. Maybe your partner's desire level feels completely out of sync with yours, and you don't know how to bridge that gap. Maybe you feel like you have all these pieces, but nobody has ever put them together for you in a way that actually makes sense. That's exactly why I put together something special. I made a complete video that pieces the entire puzzle of men's sexual health together, from the very beginning to the end. It covers fixing erection and performance issues. It covers the specific techniques that make men over 60 genuinely powerful and confident in the bedroom. It covers how to bring your partner's desire back in line with yours, so you're not just solving your side of the equation, but the whole picture. It's not a collection of random tips. It's a guided journey, from start to finish. Like someone walking you by the hand through everything you need to know and do to reclaim your sexual health, your confidence, and your vitality after 60. I made a full video about this program, and I promise you, if you've been feeling like something is missing, like you've been getting pieces of the answer but never the whole thing, this is what you've been looking for. The link to that video is pinned in the comment section and also in the video description below. Go check it out after this video. It could genuinely change things for you. Now, let's get back into it because we still have some very important ground to cover. Breaking the shame, the psychological reset. We've covered the physical. Now let's go deeper into the psychological dimension of this conversation. Because for many men over 60, the biggest barrier to maintaining this healthy habit isn't physical, it's mental. It's the shame that was installed decades ago and never questioned. Let's dismantle that shame piece by piece. Myth 1. Masturbation makes you weak or drains your energy. This idea has absolutely no scientific basis. There is no evidence that masturbation causes fatigue, weakness, or any kind of energy depletion in men. The temporary feeling of relaxation after orgasm is caused by hormonal release, not physical depletion. Men who masturbate regularly do not have lower energy than men who don't. In fact, the opposite is often true. The hormonal and mood benefits of regular orgasm frequently translate into higher energy and better daily functioning. Myth 2. It's only for younger men. Sexual desire, sexual function, and the capacity for pleasure do not have an expiration date. Men in their 70s, 80s, and beyond maintain healthy sexual function and healthy sexual desire. The need for pleasure, release, and connection does not age out of the human experience. Any cultural message that suggests otherwise is not based on biology. It's based on prejudice. Myth 3. It's shameful or immoral. This is the deepest and most persistent myth, and it's worth being direct about. The organizations and traditions that taught you this were wrong. The evidence, medical, psychological, and scientific, is unambiguous. Masturbation is a normal, healthy, natural behavior for human beings at every stage of life. It causes no harm. It provides significant health benefits. The shame surrounding it has caused far more damage through sexual dysfunction, depression, and unnecessary suffering than the act itself ever could. Releasing this shame is not just about giving yourself permission to masturbate. It's about reclaiming a healthy relationship with your own body, your own pleasure, and your own sexuality. That relationship matters. It matters for your health. It matters for your well-being. And it matters for your relationships with the people you love. The practical guide, how to do this well after 60. Now, let's get practical. Because knowing the benefits is one thing. Actually showing up for your sexual health in a consistent, conscious way is another. Here is a practical framework for men over 60 who want to build and maintain a healthy masturbation habit. 1. Frequency matters, but don't obsess over numbers. Research suggests that men who ejaculate more frequently have better prostate health outcomes. A reasonable goal for most men over 60 is somewhere between 2 and 4 times per week. This is enough to maintain the physiological benefits without creating any kind of compulsive pattern. But the right frequency for you depends on your body, your desire, and your circumstances. The key is consistency, not a specific number. 2. Create the right conditions. One of the most significant changes men notice after 60 is that arousal requires more intentional engagement. The instant, reflexive arousal of your younger years naturally mellows with age. This isn't a malfunction, it's a normal physiological shift. What it means in practice is that you may need to give yourself more time, more comfort, and more mental engagement to get fully aroused. Rushing the process or treating it purely mechanically will make it less satisfying and less effective. 3. Pay attention to what your body is telling you. After 60, your body is more communicative than it used to be. Discomfort, difficulty achieving erection, reduced sensation, or significant changes in ejaculation should be noted and discussed with a healthcare provider. Most of the time, these are manageable and treatable, but only if you're paying attention and taking them seriously. 4. Don't let shame interrupt the process. This might sound simple, but for many men over 60, it is genuinely difficult. Years of conditioning can make it hard to relax fully into sexual pleasure without a background hum of guilt or embarrassment. If that's you, this is worth actively addressing, either through conscious self-reflection, conversations with a sexual health professional, or simply through the gradual accumulation of evidence that this habit is genuinely good for you. 5. Integrate it into your overall sexual health picture. Masturbation doesn't exist in isolation. It's one component of a broader sexual health ecosystem that includes your diet, exercise, sleep, stress management, relationship health, and medical care. The men who age most gracefully and maintain the most vital sexual health are the ones who attend to all of these dimensions, not just one. What happens when men stop? The consequences of neglect. Let's spend a moment on the other side of this conversation, because sometimes the most powerful motivation isn't what you gain, it's what you lose. When men over 60 stop engaging in regular sexual activity, here is what the research tells us happens. Erectile tissue changes. The smooth muscle tissue in the penis requires regular oxygenation through blood flow to maintain its elasticity and function. Without regular sexual activity, this tissue can begin to undergo structural changes, becoming less elastic, less responsive, and eventually less capable of achieving full erection. Studies have shown that men who are sexually inactive for extended periods develop measurably different penile tissue compared to sexually active men of the same age. Testosterone drops further. As we discussed earlier, sexual activity helps maintain testosterone levels. Without that regular stimulation, testosterone decline accelerates, and lower testosterone means lower libido, lower energy, worse mood, and worse sexual function, a self-reinforcing downward spiral. Prostate health deteriorates. Without regular ejaculation, the prostate does not get the regular flushing it needs. Inflammatory substances and potentially harmful compounds accumulate. Prostatitis risk increases. And over time, the long-term risk profile for prostate cancer worsens. Mental health suffers. The neurochemical benefits of regular orgasm, the dopamine, oxytocin, endorphin, and serotonin release, disappear. Men who become sexually inactive often report increasing depression, anxiety, and emotional flatness. The connection between sexual health and mental health is bidirectional and powerful. Sleep quality declines. Without the post-orgasmic hormonal release that promotes deep sleep, sleep quality deteriorates. And poor sleep creates a cascade of negative effects across every system in the body. The pattern is clear. Sexual inactivity in older men doesn't just mean missing out on pleasure. It initiates a measurable multi-system decline that affects health, function, and quality of life in significant ways. You have the power to interrupt that decline, and this video has given you the knowledge to do it. Now, before you go, I want to come back to something I mentioned earlier in this video, because knowing the importance of masturbation is just one piece of the puzzle. And I know many of you are dealing with challenges that this one piece alone won't solve. Maybe you're struggling with erections that aren't as reliable as they used to be. Maybe you're not sure how to be the man you want to be in the bedroom at this stage of life. Maybe your partner's desire level feels completely out of step with yours, and you're not sure how to fix that. Maybe you just feel like you've been getting fragments of the answer, but nobody has ever handed you the complete picture. I built something for exactly that moment. I put together a complete, comprehensive program that takes everything, and I mean everything, and pieces it together for you. From fixing erection and performance issues, to the techniques that make men over 60 genuinely powerful and confident in bed, to how to bring your partner's desire back in alignment with yours, so you're both on the same page. It's a complete guided journey, not random tips, not scattered advice, a real roadmap from beginning to end, built specifically for men like you. I made a full video explaining exactly what's inside this program, what it covers, and how it can change things for you. That video is pinned in the comment section right now. It's also in the video description below. Go watch it. Take the next step, because you deserve more than fragments. You deserve the whole picture. Thank you for watching this video. If it gave you value, please hit the like button. It genuinely helps this channel reach the men who need this information most. Subscribe if you haven't already, because we cover these conversations regularly and there's much more to come. I'll see you in the next one.